Hi, I'm Jim in for BFR. Happy Sunday. It's August 2nd, 2020, and here's your COVID 19 update for Georgia. We'll start off with today's report, and in the report, we're going to see tests were up and cases were up both about 10% week over week. The new cases versus test percentage was 11%, so a little bit lower than we've been seeing. That's a positive sign if it continues to go down. So hopefully we'll keep watching that and understand where our trends are going over time. From a hospitalization perspective, we saw new hospitalizations again up a little bit week over week, uh, up to 69. That's not what we usually see. So something to watch for. GMA active hospitalizations, though, did report coming down. Now we dropped from a 3,200 earlier this week to 3,069 reported today. Now, the good news there is that fewer beds. The thing to not hang your hat on quite yet is the fact that we typically see this kind of reduction on a weekend. So hopefully we will see this sustained during the week. That's when to really start thinking we're seeing a trend here. The death reports were kind of counter to what we normally see on a Sunday. We had 15 deaths reported. We haven't had double-digit deaths reported on a Sunday since May. So that was a surprising number, but it's not surprising in the context of what we're seeing for the week and the trend we're seeing in cases. I'll take you through that in just a second, but the other thing that it did create was a scenario now where we're actually seeing 49 deaths a day, so more than one death every 30 minutes in Georgia coming from COVID-19. So we are definitely up on the numbers there. From a CCU perspective, we have Saturday data. We were not able to get Sunday data by the time we recorded. But from the Saturday data perspective, we saw Columbus come onto the list at be over 90% at 92%. They have 8 beds left. But both the Floyd Medical Region, Region C, and the Athens region, Region E, are taking a slight breath, and they are seeing below 90% CCU usage for the first time, at least in a few days. So beneficial for them at this point in time, and we hopefully will see that continue as well, because that's hopefully what we want, is fewer people in the hospital, right? All right, on to the weekly trends. This week, we actually had a high for tests, so I was surprised on that. Didn't anticipate that as the week was going along. But tests were up about 10% from the last 2 weeks. I know we had heard that some testing capacity would be coming online. 23,000 tests was about call it a third of what we expected to come online. So not bad. Maybe that's ramping up, and that's what we're seeing. But good news that we are getting tests up overall. So 209,000 tests. First time we passed the 200,000 test mark. From a cases perspective, cases were just down. Actually, there's a sign wrong there. They were just up week over week by 394 cases. We saw that if you look at the last 3 weeks and average those out, because we're really at this plateau at this point. We've averaged 25,000 cases a week the last 2 weeks. Given the daily positive changes we've been seeing, just creeping down a little bit, but not a lot. And the fact that, there's no significant change in activities, right? No new mask requirements, no new restaurant closings, anything like that. And in fact, the school football seasons are starting and some schools are starting back. I don't expect the case number to really make a significant deflection at this point, because there's no outside force that's going to say, all right, I'm done spreading at this point. So we'll have to see how that goes. But that's my prediction, is that we're going to continue at least at this pace for a while until something changes the dynamic of what we're seeing. Interesting article today if you get a chance. There's a opinion piece in the Atlanta Journal Constitution, probably in some other local papers as well, talks about the request from healthcare workers. They're saying we should go back to requiring masks for everybody, just like 30 other states have done. We should close bars and restaurants. We should give mayors and county commissions more power to do things. We'll see how the governor reacts to that. There's also coming up in the next 2 weeks a request for the governor to help Washington, D.C. and the Congress understand what steps he is taking in order to reduce the spread at this point. So in the next couple of weeks, we may see some changes as the dynamic changes a little bit and a little more attention is brought on Georgia when you consider the fact that in the last month, we've moved up from 9th to 5th on the state list of most cases by adding 110,000 cases in the last month. So it will be an interesting time to watch for sure. Hospitalizations slightly off of last week, 108 down, which is about 5%. So maybe that will be a good trend to continue. But deaths are really just kind of getting to that ramp up peak. If we look at the week of 7.5 and 7.12 from cases, we're kind of seeing that step up on deaths. So we know deaths are a trailing indicator. We know deaths are more manually reported. So it does take that 2 to 3 weeks to get this out. So my expectation probably in the next week is we're going to see that number probably continue to climb a little bit, unfortunately. As much as I hate to say it, I think we are going to be in a scenario where deaths are going to start catching up to cases a little more than we've seen it so far. So watch those numbers. I don't know if this Sunday number is just somebody caught up on paperwork or it's an indication that, hey, this is, the highest Sunday we've had in, call it 3 months or call it 2 months. Will that indicate that we're going to see a higher death ramp up this week? Time will tell, much like all these numbers, but I'll be around and giving you updates as we go along. So that's it for today. I do want to say a couple of things. I want to thank everybody for being a supporter, and it's been a month since we put up the virtual tip jar on Reddit, and I've certainly appreciated everybody being generous, and it helps me with my time as well. And just to let you know, I have done some things to take some of that money and put it towards other causes too. I've donated to some COVID-related charities from the tip jar. I've also donated to help save Space Camp. So that's all the space things are exciting to me, and I like the idea of supporting that. So thank you for allowing me to do that. Also, welcome back, Bob and Doug. The SpaceX astronauts landed successfully today, and it was a beautiful splashdown, and all that makes me excited. And hopefully we'll see a prototype of this rocket behind me get taking off this week. So for now, I will sign off and look forward to seeing you next week. Have a great day.